This talk is about prevention of complication in femtolithic with FS200, following the previous module of standard operation procedure. The following complication will be covered. One of the main causes of suction loss or pseudosuction is when the surgeon cannot place the suction ring properly in the centers of where exposure scars show around limbus. To prevent, you can adjust the eye position and place the suction ring in the right position. Other causes is as following: small palpebral aperture, deep-set eyes, excessive eyelid squeezing, patient's inability to maintain fixation or follow instruction. Those causes can be prevented by coaching patient to keep both eyes open and relaxed. Additional more anesthetic drop to keep patient comfortable without squeezing the eyes. Using this speculum with screw tap for tight or small lid fissure. Bulgy and loose conjunctiva is easily entrapped into suction ring and cause pseudosuction, which you may hear a hissing sound and feel loose fixation of suction ring on the eyeball. You may check the ring to make sure if the suction good or not. To prevent this problem, you should release suction and absorb excessive moisture with dry sponge. After reposition the loose conjunctiva to peripheral area with dry sponge, you can place the suction ring in the center again without engaging the loose conjunctiva inside the ring and pseudosuction. This video showing conjunctiva chemosis happens on the beginning. There is a fluid accumulation in the limbal area, but the surgeon did not stop and resuction, so resulting in pseudosuction and shallow cutting thin flap. Actually, it can be prevented by squeezing the loose conjunctiva outside the suction ring with dry sponge before suction up. About opaque bubble layer, OBL, the canal placement of flap should be located one more click outside the edge of the watermark to prevent OBL. OBL, due to laser setting, can be adjusted by local service engineer if laser energy to hide or spot and line separation to curls. Anterior chamber bubbles is caused by femtosecond laser bubbles leaking from the place where the canal passes across the limbus. Bubbles retrograde access to the anterior chamber through the trapezial meshwork via Schramm's canal. Small cornea is another cause if the flap margin is set too close to limbus. Problem of AC bubbles management will be in the excimer lasers. If the bubbles are very small, you can turn off all the room lights, let the pupil dilate, and check under dark environment till the pupil is large enough to pass the tracker. Otherwise, let patient sit up and wait for several hours until the bubbles resolve to small enough to be tracked. To prevent, the flap placement should not be too close to the limbus. Set smaller flap size for small cornea. Main causes of vertical gas breakthrough: abnormally thin flap or corneal pathology, like previous scar, may result in vertical gas breakthrough. Careful slit lamp evaluation is very important for barely visible thin scar. If a corneal scar is identified but not very deep, a thicker flap can be created to avoid vertical gas breakthrough. Thin scar here is ignored and resulting in vertical gas breakthrough as shown in red circle in this video. The main cause of difficulty in flap lifting is tissue bridges. The the fundamental reason of difficulty in flap lifting. There are causes as following: parameter setting, too much fluid between cornea and cone of PI, cornea contact not well centered, corneal placement not good, or dense alveolar happened. To prevent, keep corneal surface clean and moist evenly before docking. Keep good corneal contact during docking between the cone of PI and suction ring. Corneal opening location should be set just outside the edge of watermark. Set closer line and spot separation with lower energy. Main causes of flap decenter are eye squeeze during suction 1 or suction 2, or the cornea is not placed well centered in the suction ring. To prevent, you should take care of eye position to let cornea center in suction ring. Keep concentric circles relationship of suction ring, lightly face on cornea, pupil center, and flap mark. Maintain suction ring plane to be parallel to the floor when docking. Guide the patient relax with no eye squeezing to prevent Bell's phenomenon during docking. Main cause of flap wrinkling happen if flap is too thin, for example under 100 micron. The flap microwrinkles will be very obvious in the center. The flap thickness should be set at least 110 micron to prevent flap wrinkles. Using soft contact lens after treatment might be helpful. To prevent, sufficient flap thickness set not less than 110 micron. Reposition the thin flap carefully from the centers with the corner edge of wedge sponge. Then sweep the flap from the center toward the periphery. The main cause of bleeding from corneal sites are neovascularization in the edge of flap or blood vessels in the corneal creation area. To prevent, lightly compress the bleeding area with wedge sponge before excimer laser ablation. Corneal placement may be set to avoid vessel area. Face size should be set smaller in smaller cornea or cornea with neovascularization. See you next module. Thank you.